Thank you so much for joining us at Abu Dhabi Global Health Week.
Pleasure to be here.
Walk me through how you see a conference like this one impacting the longevity conversation.
Well, this conference is pretty important from that standpoint because it brings together just different groups, different ideas across the globe, thinking about longevity, thinking about its importance in health, and how we can actually move forward in terms of a collaboration in that regard. For example, I am a CEO of a pediatric hospital. And so how do we think about longevity? Well, we believe that longevity starts with the mom and the child in utero in terms of how do you create health in that regard? How do you create an environment where that child is birthed in the most healthy environment? Because that's the setup for that child to have a long life, a healthy life. And for us, that helps define longevity in that regard.
How important is education in what you do? And I'm talking about educating the public.
Well, it's pretty vital because there's a lot of misunderstanding. There's a lot of misinformation. And we work to how to get through that, to really provide the right information, the correct information around health, supportive health, the drugs that we give, the therapies that we provide. In that, we can break through a lot of the, I call it muck, that we have to deal with that really inhibits children getting the right health or getting the right support for their future.
How does AI, technology, innovation play into this?
Well, it's going to play an important part. I will tell you, we're still at the beginning of that AI revolution, understanding how we can utilize that in terms of its impact. One of the big things that we have to work through is what we call these hallucinations, information that is incorrect that AI is generating, and how do you sort of filter that through to really get to the point that AI can really support the care that we provide. We're seeing it in different opportunities in terms of healthcare, and I think that over the next 10 years, it's going to revolutionize what we do.
Tell me, how do you see this impacting U.S. healthcare specifically? How will it change the game?
We believe it should provide the opportunity for more equitable opportunity in health equity. To really bring that to all the different populations, whether it is a socioeconomic issue, whether it's a issue regarding where you are born or et cetera, that technology should be able to filter through and break through those barriers that we see to provide care.
You see this literally from the start of life, but there's a societal impact, isn't there, when we talk about people living healthier but longer lives? Do you think the world's ready for that?
The world's got to be prepared. I think the world is getting ready for that. And I don't think we need to be in a rush, but I do think that we need to continue to work to be prepared and embrace it. We believe it's incredibly vital. We are a pediatric hospital, a pediatric entity at Boston Children's Hospital, where the clinical care that we provide is directly tied to the research that we do. We see that feedback from research to clinical care being extremely important. If you see the work that has happened at Boston Children's over the last more than 150 years, in terms of vaccine development, in terms of drug therapies, in terms of what we're doing with gene therapy, it all starts with an idea. It all starts with a discovery. And how do we build from that to translational research, to clinical research, and how it gets to the bedside, and then how that information that feeds back to more research, we believe is incredibly vitally important.
Public-private partnerships, is that the future in terms of funding mechanisms?
It's part of the future. It can be all. In that there is an important aspect that we work with public-private, but the work that we deal with the government in terms of the work and the funding they receive in the NIH grants has been transformational.
It's crucial to your bottom line.
Absolutely. Well, to not just our bottom line, it's crucial to the future of our children. That's how I view it. Future to their health in terms of that partnership and what we've been able to do.
And finally, thinking about the future of health, the idea of longevity. Obviously, you see this from the very beginning of life. What are the challenges in your mind?
Education, getting the right therapies, the right information to all aspects of our society. One of the biggest challenges is really putting together physical health and mental health. That's one of the big challenges that we continue to observe and are working through. How do we actually connect those, making sure that the view is that without mental health, you can't have physical health. And how do we bridge that? It's extremely important as we move forward.
Tell me how Abu Dhabi plays a role in this conversation.
Abu Dhabi has, as a region, has done an incredible job of being a convener, a place that many groups can come and have the conversation. And then Abu Dhabi has worked to really be an innovator, asking the question of what's next, and being incredibly aggressive about how to implement those ideas and those innovations. And we learn a great deal from that.
Thank you so much for joining us.
Thank you.